Good morning from sunny downtown Blue Ridge, Georgia. This is BKP and Ray Tidman and Bill Whaley on Ask the Doc. We're having a different sort of an opening today. They're shingling the building next door here, and BKP's got such a bad back he can't lead forward. He can talk, however, and he will be doing it in a minute. And this is not a prop. I'm actually on it. And lastly, the political statement for the tie this week is not the tie at all. It's the Coke, if it's the drink product. And take it away, BKP.
You know, there was a thing we used to say. We hope you never get captured in the war. Could you? Lord, you don't have to tell them that this is it for me. I'm stuck right here.
Yeah, you are, right, all right. So anyway, that's a different opening for people
Well,
who are tired.
as you're explaining, Dr. Whaley, welcome this morning, and thank you, Georgia Cancer Specialist, affiliated with Northside Cancer Center. As Dr. Whaley will be reading these questions and we go through them, just want to remind you this is a live show. We're in downtown Blue Ridge. They're putting shingles, and I might get my attention deficit. I might look over and watch the guy putting roofing shingles on. But we're going to power through. We know you can hear us. And Dr. Tidman,
I just wanted to say that, since I'm here with two lame people today, that maybe I'll come up with a lame joke.
All right, into the show. He's promising a lame joke.
Okay.
You ready?
Hey, take it away.
All right. We interestingly enough, we got two great, interesting questions today, and I have dug into one of these and actually called back the patient, got a little more information that's on here. So we're going to start with this one. This is a PCP type question. My wife has long-term asthma, and a CT scan last week that showed an egg-sized mass under the chest bone was not seen on an x-ray 5 years ago. Now, the PCP had to be worried about, she had a cough, had to be worried about the cough, probably thought she might have had COVID or something, but in any event, the opportunity was taken to do a CT scan, when in the past they had done chest x-rays. The radiologists called it probably a thymoma. Now, we've been doing this program for 5 years, and we've never talked about a thymoma.
No, I don't remember that one.
So that must tell you that they're not real common. We actually mentioned the word before when we're talking about tumors in the chest. But anyway, what is this about? And what do you think that we can expect? So, first thing I need to tell you is what in the heck's a thymus, right? Is that, would you know what a thymus was?
No, I do not.
You don't?
No.
I sent you the questions. You're supposed to do a little background.
Okay. I don't know what a thymus is.
All right, Dr. Tidman will tell you.
Tell me what a thymus is. Help me cheat in this
all right, now
help me cheat in this class.
Yeah.
Anyway,
You
so
look over my shoulder.
Thymus, is that going to be part of your joke?
Yeah.
Thymus is a gland that is big in children at birth. It is underneath the breastbone, and it's the site where all of the T cells, you've heard us talk about T cell, B cell, lymphocytes, and immunity, start out in embryogenesis before the baby's born, and they go out into the bone marrow, liver, spleen, and all the places where T cells live. And then as they get to adolescence, it begins to atrophy and to disappear. So that there's a thymus you can find in children, but when you get to adulthood, it's basically gone. So show that first picture up there. One of our fancy pictures here for you BKP. So that thymus is hanging right up underneath this breastbone right there. You see all those little T cells that's sending out here to the bone marrow and the liver and the spleen and everything?
Yes, I do.
That is a huge part of this immunity. Remember about the COVID and the B cells. Pull that thing down a minute. Don't put the next one up. Frequently, a thymoma is diagnosed because what we used to call, what do you call a real difficult case to diagnose,
A fascinoma.
A fascinoma. Okay, so patients would come to a doctor, they'd be weak, or they'd have different types of rashes or muscle problems or something. And you've heard, and we've talked before, we've talked about myasthenia gravis, we've talked about vasculitis, so autoimmune disorders that are linked to the thymus can include total red blood cell wiped out of your bone marrow, aplastic anemia, all the way to myasthenia gravis, which is the weakness. Put that next one up. Now, you've heard this stage before called paraneoplastic syndromes. So some of these thymus tumors are diagnosed because the patient has this funny looking rash, or they've got Addison's or some sort of endocrine disease. They can do just about anything. All right, pull that one down over there, Dave. And these tumors, there's a whole bunch of stuff. You always see we got a thing full of tumors. These things can be divided into bunches and bunches of types. You don't really need to know a whole bunch about this. You pull that down, Dave, just so we know we did our homework. But basically, we used to think, now we know everybody knows it's my 50th year in practice, we used to think that a sizable hunk, let's say 20-25% of thymomas were benign, and when they were removed, because patients didn't have any of these paraneoplastic syndromes, it didn't invade anything, but we now know over time that virtually all of these have some degree of pre-malignant potential. So the fact that this tumor is there, you're not going to just watch it. There's lots of stuff we watch and wait, right? But a tumor in the mediastinum that might be a thymoma, we're not going to watch and wait. All right. So the biggest thing that we have to do about this, and one thing that they didn't really ask, but they suggested that they do an MRI instead of a biopsy. Now, every time we talk about a lump in the right chest, it's not in the left chest, a lump in the breast, it's not in the left breast, we say, stick a needle in it. Now, this is a real unusual situation, right, Ray?
Yeah.
We're not sticking a needle in it. Why not? We don't want to drag that sucker through good tissue if it's a thymoma.
We don't want to spread it out.
Yeah, we'd be letting it out of the bag, so to speak. All right, so put that next one up there, and then we'll pull it down. But what the way you stage these things, and I'm predicting that this one on MRI is going to be early stage, and that means that it's going to be completely encapsulated in sort of like a gristle and will not have invaded anything, and that it will be surgically removed if the MRI allows. It'll be surgically removed, and that'll be the end of it. Go to that last picture, because you guys are real good at MRIs and CT scans, but this is an MRI of an anterior mediastinal mass that's not encapsulated. You don't have to be a rocket scientist, BKP. You see where all those things are going out in those bones in there?
Right.
That's not good, is it?
No.
Can't get it. All right, pull that one down. So here's what you do. If that tumor is not encapsulated, it will be surgically removed to the greatest extent possible, and that's going to be a fancy operation. If it is malignant, that patient will get radiation therapy, and the chances of cure will be quite high. This patient did not present with myasthenia gravis, anemia, any of those weird endocrinopathies or any skin disorder. But often when this thymus is removed and is radiated, that paraneoplastic syndrome goes away and the patient looks like back to normal. So what you can expect is, I expect it fully to be encapsulated. She will go to a cancer center, a thoracic oncologist will remove this tumor, and my expectation is that'll be the end of it. I will hold out that it could be invasive like that, but it's unlikely given the history, the way that scan was originally written, and the fact that she went in there not because of pain caused by this thing, not because of a paraneoplastic syndrome, but because her PCP was all over the fact that she was coughing and thought she might have had COVID or something. So you go back to this pancreatic cancer we talked about a few weeks ago, where the patient went in there for a gallbladder ultrasound, and then a tiny little pancreatic cancer was found. That's how you cure pancreatic cancer. You find it when you're doing something
very
else.
early, which is rare.
Well, right, because you did something else. All right.
So
okay,
in the
right.
Thymoma, I actually have an earlier case to this. It's a very similar presentation. It was spread, and the patient did receive radiation therapy. one of the other things that happens during this surgery is there's a phrenic nerve that travels right in that area, and it's what helps move our diaphragm up and down when we breathe. So her phrenic nerve was clipped on one side, and she's always had a collapsed lung over there. But her, she's just recently developed on a mammogram right outside the window, or maybe at the window of where the radiation therapy occurred, breast cancer. So literally this week she's going to go get a biopsy of that. And one of the things, and we're talking about a 15, 20-year-old case. I'm not exactly sure when we found this, but so she's outside that window of when secondary cancers can occur from cancer treatments.
Yeah, but she's right in the window for prior radiation therapy.
Yeah, that's what I'm saying. Yeah.
So with teenagers and young adults who got radiation, we've done up at these before for Hodgkin's disease or something, then they're at increased risk for heart disease from the radiation, lung disease from the radiation, and breast cancer. And the PCP has to stay all over, annual mammography, annual exam, check their thyroid because it got radiated, right? That's PCP's job.
Right.
Is that Brian's job?
No. Bryant prods people to get in to see their doctor.
Yes, I do. That's my role.
Right.
Go see your doctor. That's my line.
How's your back?
It's in the script.
All right, you want to do this other one before we start getting into the bad
Yes,
jokes?
yes, I do. Thank
news?
you, Georgia Cancer Specialist. Again, Northside Cancer Center. We appreciate you for this segment of Ask the Doc. And again, a minute ago, you might have noticed I went like this. We're in downtown Blue Ridge. It's great. People take walks, and they down the sidewalk walk their dogs, and it's good to know your neighbor, right? It's good to.
And in fact, that you look around during the program and watch the shingling.
That I don't pay attention? Is that what you're saying?
Well, I mean, we talked about that.
We have roofing shingles going up over here.
We talked about that in the green room about the tension, All right, so this next question is the one where I contacted.
Kindergarten teacher said to my mom said to the kindergarten teacher, "How is Brian doing?" Said, "Well, he did very well last week, but this week they're grading out there for a new baseball field, and I can't get his attention back because he wants to watch that bulldozer."
Bill, I think we need to increase his medicines.
Is that what it is?
What we need to do,
two.
I don't know if that's his big Red Bull over there or not, but I think he's already had 2 cups of coffee this morning. I'm not sure. All right, this next question I actually contacted by email and then by telephone the person who asked this question, and it's going to be a strange sequence we're going to go through when we're talking about this patient, but I want to make it really, really clear that every patient is a bit different, and that taking a really accurate history and knowing some facts help you. Listen to this question. My father is 90 years old, and up until 3 weeks ago, he was cutting 4 acres with a tractor and doing farm work. He is weak, and the ER did a scan and said he had osseous metastases to his pelvis and spine. That means cancer is in the bones. He has had a backache for 20 years since he fell off the barn roof and did some crush fractures to his back. Well, we know they haven't limited him because 3 weeks ago he was on a tractor. His PCP sent him to an oncologist who did a rectal exam, the first one he's had in 20 years, and said his prostate is as hard as a rock, lumpy and huge, and he probably has prostate cancer. He wants to do some scans and blood work. Should we send Dad to hospice? That's why I made the telephone call. Because the next sentence, listen carefully, his mother lived to 98, and his father died of infection when he was 45. So this man, up until 3 weeks ago, was doing stuff that people decades younger would do, and all of a sudden, something happened to him that made him weak. It affected his mental status, and it's like he was drunk, or on something. Put up that first thing if you would, please. After talking to the family, this patient has metabolic encephalopathy. Now, what does that mean? You heard that a lot of times. Oh, you have to. Metabolic encephalopathy, it's like you're drunk or on a drug where something in your body is causing your mind to go down. Frequently, you could have that with kidney failure, with liver failure. Somebody who has a huge prostate and bone things probably has a high serum calcium. But that doctor who wanted to do some lab work is checking that right now. And if there's kidney failure or hypercalcemia, it can be treated. Go to that next one. So there's 100 different things that cause metabolic encephalopathy. And the real challenge in an emergency room is to know, did this patient have an intercerebral hemorrhage and they are about to die, or they are the influence of drugs or carbon monoxide or carbon dioxide? It's a very difficult examination for a PCP or a guy in ER, right, Ray?
Oh yeah, I mean, this is altered mental status, and the list of possibilities that can cause somebody's mental status to be altered.
Put that next thing up so Ray can see the 15 on that.
Yeah.
We're not going to read them all because they're too small, but Ray said there's a long list of possibilities. Now, we had some metabolic encephalopathy. Pull it down now. We had some metabolic encephalopathy in this community about 36 months ago, roughly, in adolescents and teenagers who were at the school and on the playground. Do you remember that? Severe metabolic encephalopathy. What was that related to?
I don't know.
Vaping.
Oh, that's right. That's right. I remember. Oh,
Yeah. That's not ancient history.
I got no.
You remember? They got unconscious.
Right.
And they didn't know what was going on, and that was toxicity from vaping. Well, just imagine, this is not quite the same, but Dad went downhill so much he's bedridden. He hurts like the devil in 3 weeks. Okay.
Bill, let me just refine this question here. Was their first concern the pain that he was in, or their first concern was that he was not behaving normal?
Oh, totally behaving.
Yeah.
Because the pain's been there 20 years. This pain that he's having is not related to this stuff in his back.
Okay.
That's the point.
Yeah.
He's had a backache for 20 years since he fell off the roof. His mental status changed.
Okay.
And then when they went to the ER and they got the scan and they says there's bony cancer in his bones, their mental image was, well, maybe that's pain from the cancer. It's only after drawing it out that we know this pain's been there for 20 years. This is all metabolic. His kidneys are either blocked and he's in renal failure, or his calcium's high, and they'll be all over that like a dirty shirt the next day or two. All right, put that next one up with that aging thing. Well, this was 2 weeks ago. We said, if you remember, I talked about the autopsies in the Armed Forces Institute of Pathology. This is the incidence of cancer of the prostate as you get older. What's that, a big old arrow going forward, right?
Yes, aging.
Okay, well, now, I'm the oldest. He's the next oldest. You're the least old. He's a kid over there. But all of us have got some pre-malignant or malignant, I've actually got prostate cancer stuff in our prostate. And it's not uncommon that a guy of 90 years old would have some prostate cancer if he was autopsied. But
well, pathologists say if you autopsy all 90-year-old men, you can find prostate cancer in it.
Right, but you don't find a gland that's as big as a baseball, nodular and hard, which is what they said this was. So pull that next one up here. This is the decade of life when you diagnose prostate cancer. You can see it. This looks like the fatality rate from COVID, almost none below age 50. But when you get up here to 85 plus, that's only 4% of people who are diagnosed with symptomatic prostate cancer at that age. Why? Most of them are dead. I mean, not a lot of people in that age group. So this man, I'm not going to say that the PCP 20 years ago, he would have been 70, should have done a rectal. But if the guy's family lived to 98, did I say? If his family lives to 98, you treat that 70-year-old like a younger person. And yes, you're going to do a mammogram, and you might do a PSA and do a rectal exam. So anyway, pull that one down. What do we got to have for old BKP?
Survival chart.
This man can be symptom-free in 4 weeks if his metabolic encephalopathy is confirmed, if his PSA is 1,000,000 and he gets a few hormone shots and some pills. It is my prediction he'll be back on his tractor, certainly, by Thanksgiving maybe, or by Halloween. Don't send him to hospice. And I felt so strongly about the question that I called the family and talked to them, and they're doing what they ought to do, in my opinion. And Dad,
so they're fixing his encephalopathy. They're finding out, first of all, what is causing it. They'll address that. They'll treat his prostate cancer fairly conservatively.
Yeah, they'll never have to biopsy it or anything else. His PSA's high.
Yeah. Do you think there's any prostate cancer in the bones?
Oh, of course.
Okay.
Yeah, I think.
Will they do any radiation therapy, spot therapy?
No.
I'm just talking about for pain mitigation.
No, I think his pain's not due to that, because his pain has not changed. His pain's exactly like it's been since he fell off the bar.
He's a tough dude.
He's a tough dude, but it was all that change in mental status, and so that's why you can't do this over the daggone video.
No.
Got to go in and see your doctor.
It's interesting you bring it up in the window of aging, because that's one of the things that I do with my new patients is when I'm doing their history and stuff is I ask about diseases in the family and how long their parents lived. Now some may say, well, I don't know, Dad was estranged and I don't know when he died or so and so. But if they've got a parent that lived up into their 90s, then I joke around and say, well, you picked the right parents. But we're basically setting expectations in that visit of how long do you mentally care and think that you can live? It's almost like if we don't know our parents' longevity, we get up to that age and we're going through this black curtain. We don't have examples in our life of people living that long in our family. And it's a different mindset to get through.
Yeah, but and siblings. I mean, you got 7 brothers and sisters, and you're the youngest. I mean, you got a lot of good history you can go on.
Did you pick the right parents? I think you did.
Oh, I did.
Your mom's side.
Yeah, I picked I picked the right parents, I guess.
You got well, I won't say the lucky, but you were fortunate to be born in America.
Yeah.
You were fortunate to be born after World War II, as the country has made great progress. We were a little more fortunate because people in our generation were measured on their work and what they did, and not on the world owes us a living.
Not on showing up.
All right.
Oh no.
And now we've got some stuff we got to talk about.
First of all, thank you, Georgia Cancer Specialist affiliated with Northside Cancer Center. We always appreciate you for this segment. That's in my script.
All right.
That's what I do.
All right. Now, I sent Ray this list yesterday of the things that were in the news. Remember how back before the 4th of July, back in late winter and the winter of last year, everything was COVID.
Yes.
And then beginning about May up till July the 1st, we had 15 things that none were COVID, remember?
Okay.
On July the 1st, none were COVID. And this number right here of positive tests this week, which is, what's that number?
18.1.
Was 1% before January. Now before July 1. Now we know that in Fannin County, that positive number is 28%. And this is one of the top counties in the United States for positivity today. So, what this thing was telling you about, and I wanted Ray to pay a little attention to the very first one about COVID-19 hospitalization spike in children, because there was a graph there, and Ray's a rocket scientist, and it showed that 0.4 per 100,000 population, which sounds like it's 4 out of a million. Is that about right, Ray? 0.4 in 100,000, 4 out of a million?
That's a lot of looking around to find that.
That's the hospitalization rate for kids under the age of 12.
And the author of that graph was graphing this graph, which the left scale, the y-axis, was 0 to 1, okay, out of 100,000. So 4 out of 1 million. And the grapher was trying to make this thing like, oh my goodness, children are, it's just going awful. Well, you can blow up anything big enough that, it's like Oklahoma. We say it's flat as a pancake. Well, if you shrink down Oklahoma, it's flatter than a pancake. It's just what you do at the scale. So it's just somebody using math to scare people and to jack things around.
All right, now I want to pull that out of there, and I want to just say one more time, I'm not worried about your kids.
Right.
All right, now, what is the last one on here? I believe that people that are obese, people over the age of 70, we already talked about this, ought to go get a vaccination. I think everybody else can make their own decision about it. But what is this one right here? What's that say?
Teachers have no higher risk of severe COVID-19.
All right, so the top thing on here is all these kids. Well, as Ray says, if you double 2 in a million to 4 in a million, you had a 100% increase in the hospitalizations of children with COVID virus, okay? Now, that's a tiny blinking number. You can put that 2 ways. It's gone up 2 per million, and you say, wow, that ain't nothing, or it's gone up 100%. The schools that have been shut down and these teachers that are all over these counties holding these flags, don't kill me. The teachers, one more time, this article is going to be published today.
Have no higher risk.
The teachers have no higher risk of severe COVID-19 infections or outcomes than anybody else that is age matched, weight matched, and comorbid disease matched, period. So it's not like first responders and police have more traumatic deaths crying at night. They do. It's a dangerous job. But teaching is not a dangerous job in relation to COVID, period, paragraph, end of report.
All right, can I digress?
Digress, but I have something too today. Go ahead.
I've
been laying back, not just because
your back hurts so bad.
Right, but I've been laying back waiting for a reason.
You're waiting to pounce.
That's right.
What did you like Crocodile Dundee when you were younger?
Just move it along. Sir.
All right. So anyway, Crocodile Dundee.
This is a knife.
Yeah. This and I've got one of those knives. Okay. So but anyway, I mean it's about Australia where you live free and you walk around in the swamps and you fight with alligators. I mean it's just strikes you as this free country. Those people have lost their minds.
Right.
They're under martial law. They're being told that you've got to drink through your mask. They're being told not to talk to your neighbor, and when you go to the store, don't talk to anybody and get right back home. I mean, it's maddening. And I'm starting to think that we have a COVID infection going around, and it meets the qualifications of an epidemic or pandemic. But the pandemic that we have is tyrants. We just have this blossoming of all of these small wannabe tyrants who want to control people, and they want them afraid, and they want them owing them something, and they want to be in charge of their lives. And I think it is a social disaster now what these tyrants are doing. So my plea to my public is get on with your life. And when you find a tyrant, pull out a copy of your Constitution and stick it in their face and say, get away from me. You are not running my life. Leave me alone. I will take care of myself. I'm an American. And I mean, if I could just snap my finger and say, let's all take that attitude right now, the whole attitude of this country would turn around in a second. And it's not just COVID. I mean, it's all over the place in all kind of features, but it's like the whole movie series or the whole kid things about Walking Dead. It's almost like the walking tyrants have come up out of the ground and they're running around finding somebody they can reign over.
All right, now I want to throw that. I'm going to come back the other way. How many deaths in Fannin County as of today?
I don't know. 74,
what was it last
75, week? 76, 82.
So since last week.
Now let me tell you what you just did to me.
What?
You did what they're all doing to me. You didn't give me no details. You just gave me a number and went up.
didn't.
I don't know what their age is. This comes for you taught me
Oh,
this.
you're right.
You taught me this on my questions
Whoa,
for
whoa,
years.
that's the important
I don't know
question.
their age. I don't know their medical background.
Right.
I don't know if they were scheduled to leave this world in 6 weeks and the good Lord said they're coming home in 6 weeks. I don't know any of that. You just upped the number.
Correct.
And I don't know if maybe
I'm absolutely, that's absolutely 100%
Thank
true.
you.
And I'm glad that you brought that up, because Ray's the guy that can shed light on this. We have a hospital that's it's next to the old golf course up the road here. We talked about it last week. It's got a bed capacity of 44 beds and 77 people in them. And the 77 people in that hospital are 60-something COVIDs, and the other 8 or 10 or something else. And yes, these people that are succumbing are exactly who Ray was talking about. Those are the ones who, he says, figure out what your risk is, learn how to live your life, and if you just choose not to get the immunization and you're 82 years old and you're overweight, then you're going to end up as a statistic. And that, I don't believe that there's anything you can say stronger than what he has said since the first day, which was protect your fine china.
Yes.
Now, whoa. But the problem is, the fine china is being also lulled into thinking that, I shouldn't go get immunized because there's these people in the newspaper saying they got immunized, and I don't want anybody telling me what to do. You've got to be able to reason with, and I had a patient yesterday who's on cancer chemotherapy, who's 75 pounds overweight and is over 70, who says, I'm not getting that shot. It's being politicized by the Democrats. Well, it is being politicized by the Democrats. You're exactly right. But your risk of dying of this thing is really high. You'd be doing me a favor if you went and got your shot. I'm going to tell him that again and again. I'm also telling him, like I tell every patient, I'm treating a human being. I am going to treat you the way you want to be treated. I'm going to give you the information I've got, and then you're going to make a decision about whether you want to go to hospice or you want to go, like your dad here, or whether you want to go get that shot. And that's what Ray's saying.
Yeah.
Talk to your doctor.
We have to get out for our next segment.
Why is that?
But we got to get out for the next segment. But let me just say this: we are on another Friday night and another high school football game here in and now it's in Western North Carolina, but just right across the line is canceled. Now, let me ask you two doctors this. Some people get upset when I make a relation to the flu. I understand it's not the flu, but if you're the high school football coach and you just go back,
they shouldn't get upset. You're trying to say compare X to Y. We know what X is. We've lived with X all of our life, so compare it to that.
Exactly. So 2 years ago, coach, I got the flu, coach. You get home now. I don't want to see you out. I don't want to see you around any of the players. Get home. Don't touch nothing. Get out of here. Let me know when you're not contagious. Get out of here. Boom. You guys get back out on the field, right?
Yeah.
When it was
You
2
remember
years
the
ago.
Montreal Canadiens?
2 years ago. I'll never forget Patrick Waugh having his appendix taken out and playing too. Let's not start.
Well, I'm just saying, the whole Montreal Canadiens
Exactly.
team,
But-
9 of them sick. What they do? They send them
No,
home
wait a
and they
minute.
got 9 minor leaguers and played the game.
So the coach says, you guys get back out on the field.
Yeah.
The coach doesn't say, oh, you have the flu? Now, who all of you been around in the last 72 hours? And, 12 people? We never did that before. But they are now. They're shutting it down.
It's the
now.
opportunity to be a tyrant. Oh, I've got information here. I get to control your life, and I get to make these decisions, and I get to feel big about myself.
How many years have you watched the big college game or the Super Bowl or the playoffs, and the announcers are saying, he came in with flu symptoms yesterday. They gave him some shots. No, he's playing because he's Tom Brady or somebody like that.
They gave him
He's
IV
playing
fluids.
He's playing today with the flu. They didn't say, "Oh, you could get the rest of the team sick."
No, we don't want a kid playing.
Now I want to say
we don't want to infect a kid.
No, I'm not saying to
because
play
like
with.
part.
I'm not saying to play. But the extreme we're going to a canceling games. Now let me say this: a kid, it's heartbreaking that in such so early in life, to lose life so early. This kid died in 8th grader, okay, and it was on the news. He was in the 8th grade. And the actual read this probably off the teleprompter and said, in the 8th grade, he died with COVID-related symptoms. That was the quote. That was the quote. COVID-related symptoms. Now, they didn't say it was positive. Maybe it was. But he died. But, boy, they blasted that all over the news, that 8th grade kid had died.
Yeah, and life goes on. One other thing, Bill, I had a case, and I don't think I have talked to you about it, but it's a new patient with anemia who's had some black stools and has a history of polyps 3 years ago on a colonoscopy. And I tried to refer them to the hospital to get a colonoscopy and a workup. Okay, anemic, symptomatic, probably has colon cancer. Okay,
Yeah.
no, we'll have to wait until COVID's over. We're too busy here. Since when does cancer wait on COVID? I lost my mind. I said, well, I'll find another surgeon.
Last year, the diagnosis went down. Then in January, February, and March, it went up because people were doing colonoscopy. It's falling again now.
I have to get out. We good?
We're good.
Wait, is everybody else in the green room?
Everybody's in the green room. Everybody's ready. Georgia Cancer Specialist, affiliated with Northside Cancer Center. We appreciate you so much for this Ask the Doc segment. And we'll see what we can't do to get these guys back next Friday. Until then, FYNTV.com, Ask the Doc. Share it with your family and friends.
Take us to break.